Let's talk about bone density testing and its importance. People often think that bones are static, but they're actually in constant transformation. Even as we speak, our bodies are constantly replacing old bone with new. However, as we age, we often lose bone faster than we can replace it, which can lead to a condition called osteoporosis. Osteoporosis makes bones weak and brittle, and can result in fractures from even minor impacts, like tripping on a rug. In the US alone, osteoporosis causes around 2 million fractures each year, including 550,000 in the spine, 300,000 hip fractures, 400,000 wrist fractures, 810,000 in other parts of the body. These fractures can lead to severe issues like chronic pain, disability, and even death. The problem with osteoporosis is that it doesn't show symptoms until a fracture happens. That's why bone density tests are so important. They measure how strong your bones are and help diagnose osteoporosis before a fracture occurs. So, who should get bone density testing? Osteoporosis is more common in women, especially after menopause, and in older adults. Generally, healthcare providers recommend testing for postmenopausal women and those 65 and older. However, if you have risk factors like smoking, long-term steroid use, low body weight, rheumatoid arthritis, or a history of fractures, you might need testing earlier. There are different types of bone density tests. Dual energy X-ray absorptiometry. This is the most reliable test. It uses very little radiation to measure bone density in the spine, hip, and wrist. It's great for diagnosing osteoporosis, predicting fracture risk, and checking how well treatments are working. Quantitative computed tomography. This test measures bone density in the spine but uses more radiation than DEXA and isn't used for diagnosing osteoporosis. Ultrasound. This test measures bone density in the heel to assess fracture risk but isn't used for diagnosing osteoporosis or monitoring bone density changes over time. In summary, bone density testing is essential for early detection and prevention of osteoporosis-related fractures. If you're at risk, speak with your healthcare provider about getting tested. Check out my video about DEXA scanning to learn more about it. Subscribe to the channel for more content. Thank you.